Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Dr. Rani Khatib about the updated NICE quality standards for chronic heart failure. Dr. Khatib, why don't you start by introducing yourself?
My name is Dr. Rani Khatib. I am a consultant pharmacist in cardiology and cardiovascular research and associate professor at the LICAM at the University of Leeds with multiple hats, including being involved in the NICE heart failure guidelines committee back in 2018, and of course the recent quality standards which were published in 2023, with contribution to the European Society of Cardiology task force on cardiology allied professions, and also co-chair of the cardiovascular group at the UK Clinical Pharmacy Association.
Thank you. Now, can you give us a brief overview of your role, what your current job involves?
I'm a frontline clinician, so I have responsibility of running several clinical services, mainly leading on several innovative cardiology outpatient clinics, which are focusing on the risk and medicines optimization within the within mainly secondary care, but also contribute to a variety of projects within primary care as well. So the clinical role is quite heavy, but I've got another research hat where I do invest in a lot of research projects in order to quantify and qualify and support the service we provide, and mainly interested in patient-centered care, person-centered care, adherence, better multidisciplinary involvement in the delivery of care, all within the remit of the cardiovascular arena.
You are a member of the NICE Guidelines Development Group for Chronic Heart Failure, and therefore also a contributor to the quality standards for this topic. And that's what I want to talk about during this interview. But first, could you just, in a nutshell, remind us what is chronic heart failure and why is it important?
Heart failure is a complex syndrome which basically represents some kind of insufficiency of the heart to meet the need of the body, basically. It leads to symptoms which can impact hugely in quality of life, including shortness of breath, fatigue, fluid retention, and it's quite a devastating condition to have because it tends to be chronic, and it impacts hugely on not just quality of life but also mortality. So it needs to be addressed, and it has a huge burden on patients, but also on society and the NHS, of course.
The NICE guideline on chronic heart failure was published in 2018. Now, surely the guideline tells people what to do. So what is the purpose of quality standards?
The guidelines from NICE tend to be a bit more broad. It will have multiple recommendations about different aspects of the management and the treatment of heart failure. Of course, we need to remember it was in 2018, so the field of cardiology generally and heart failure in specific has come a long way, of course. So there's probably a need for updating some elements of the 2018. The quality standards are more focused on priority areas. It builds on the guidelines, but also it builds on some of the technology appraisals that came out since the guidelines. And we've got a few of those that came out in heart failure. And what it does, it actually focuses on quality improvement areas and priority areas for the interest of basically the management and the diagnosis and the support of patients with heart failure. So it is more snappy, it is more focused, and it's usually tend to bring up concise, measurable statements that different members who are involved in the healthcare continuum are able to assess and audit against.
Mm-hmm. So could you now give us an example of a quality standard and how it might be used in practice?
Yeah, so quality standards tend to be quite limited to about 5 or 6 statements, no more than that. And the reason behind this, so that it is focused on really the high priority areas, and it tend to want to focus on where there is evidence of the need for further enhancement, improvement. So let's take quality standard 3, which talks about medications for chronic heart failure with reduced ejection fraction. And that one talks about how patients with, and the reason it's selected reduced ejection fraction, because of course the evidence base and because also the guidelines are based around that. There's emerging evidence about preserved ejection fraction, but this is not yet as well established, but it's coming through. So the statement says something along the line of adults with chronic heart failure who have reduced ejection fractions receive all appropriate medication at target or optimal tolerated doses. Simple statement talking about that we need to pharmacologically manage patients with these evidence-based therapies. Now, the rationale and the detail comes usually later in the quality statement. So I would advise that when you read the quality statement, don't kind of leave it at that. Go and have a read a little bit of the detail around it, which is actually in the quality statement document, and it will tell you a little bit more about what do we mean by appropriate medications, but what do we mean by optimal tolerated doses? What's the rationale behind identifying this quality statement, and what's probably your audit, what you should be auditing if you were to look at that.